me a sec. I don't have this cool filter on YouTube though. What do you guys think about this? What's a Merkel's diverticular? There's no such thing as a Merkel. It's Meckel's. It's called a Meckel's diverticular. What's up, YouTube? Hey, so I'm running this. This is Instagram right here, and this is YouTube right here. So I'm gonna do both at the same time. So this half an hour, I'm gonna give away. What is this? I'm gonna give away some FIGS scrubs. So you guys stick around to the end, and then we're gonna give away some free shit. I like them apples. So I don't see my chat. We're gonna give away some, whoops, free. How about that? All right. So YouTube, I see your chats now. Hi from Sweden. I'm at work. Yes, I'm at work. Oh, let me get comfortable here. So free stuff. That's right. However, first, of course, I will answer questions. What do you want? Free shiz. YouTube and Insta both open, tripping me out. Yeah. Let's see. Hi from Sudan. Why am I considering skipping my exam to watch? Do not do that. Do not. Okay, go to the exam. It's important. So, yes, casting couch is right behind me there. That's dirty, huh? Oh well. I don't know what kind of casting couch you're talking about. That's not good. Serbia. That's sweet. What was dissection class like? You mean like you're talking about like anatomy. So anatomy, I don't know, it's smelly. But it's like the coolest class because it's kind of gross, and I like gross stuff, and you get to learn anatomy like for reals instead of just in the book. Can I explain my last IG post with the bowels? That was an intussusception, and so with intussusception is if it's a child, then sometimes you can do the barium and resolve it, but because typically those are they have intussusception because there's excessive lymphoid tissue there, and it provides for a lead point, and so the bowel is essentially like if it's a sock, if you stuff half the sock in the other half of the sock, that's what intussusception is. But in adults, then it's like 50% of the time it's some kind of malignancy, so you need to take that out, make sure that either it's not malignancy or if it is, it's out. Need more surgical videos. I know, I'm working on that. Okay. I want to become a doctor too, and I'm applying this year. Do I have any tips for not getting stressed during the exams? Propranolol. That's medication's bad. Studying your ass off is a good way to ward against being nervous for an exam. Study nursing cadavers in nursing school, but very stinky. Well worth it. Trade the experience for anything. Cool. What's the most common surgery I perform? Appendicitis, so laparoscopic appendectomy. Cholecystitis, so laparoscopic cholecystectomy. Those are two ones. Other ones are hernias, bowel obstruction, and bowel resection, lysis of adhesions. Those are bowel obstructions, and the colon resections for diverticulitis. I went to med school in a Caribbean school. It's called St. Matthew's. I don't recommend going to Caribbean school unless you have to. Rafa Remedios, hi from LA, sweet. My pre-exam ritual. I didn't have a pre-exam ritual to help me relax. Actually, I didn't care about relaxing. What I care about is crushing the exam. One thing I did not do is go into the exam or the classroom early, because a lot of people start talking about the questions that they think are going to be on it, and then they start like freaks you out. And exams are just like a game, like the Super Bowl. Like you have to be psychologically on your game as well. So that's I think it's a really good tip. Have to be positive mindset and thinking like you're going to crush the exam. Carotid artery surgery is the survival rate is high, yes, but there are complications. That's not my specialty, so I don't remember the numbers. But there is a significant. I think it's less than 10%. I want to say like 5% stroke rate on that, or maybe less. But if you don't get it and you go with medication, so many years, I think it's 1 to 2 years, it's like 11%. Oral exams, yeah, in Italy. Yeah, for the oral exams, what you have to do is you have to do that before you go. You don't want to do that the first time. So you have to practice with a partner. That our general surgery certifying examination is an oral exam, and I had to practice with a partner too. The first time I failed it because I was so nervous, actually. And the second time I practiced with a partner, I did different studying, was more confident, I did well. Do I usually have emergency surgeries? Yes. Am I really doing a FIGS giveaway? I'm so glad you asked. This is what you guys get. See that? Not this one, but your own. And a pair of pants. So it says scrubs, whatever color you want. It's nice, yes. So at the end, what I'm gonna do is, so you guys know I have this new study course, and for everybody who purchases the study course by 12:30 Mountain Standard Time, which is 2:30, which is 11:30 Pacific Standard Time. I'm going to go through the people who have bought it have just been on right now. So from basically 2 p.m. Eastern Time to 2:30 p.m. Eastern Time. All you guys are going to be entered into into the raffle or whatever, the giveaway, and then we'll pick. I think three people will get the scrubs and a hat. You also get the hat, which I showed you guys, I think today or a few days ago, but I forgot the hat at home, so you can't see here. But if you go on FIGS website, you'll see they have hatters. This is secretstudyhacks.com, so I'll put it in here. So it's in, first of all, it's in the, oh crap, no, I screwed up. No, it's all right. First of all, it's the link in my bio, and then it's just secretstudyhacks.com, and I just typed it in the chat box in YouTube. You bought the course yesterday? All right, what's your name? I'll put you in the thing, because we have automated deal. It's like it's not just picking out of a hat. It's like actual computer. So we'll put you in. Let's see. What else? Let's see. Answer some questions here. Worse than a four grade burn in small body. 1 or 2 grade. I'm not sure what that means. Best advice for an IMG with average step 1 score and doesn't see himself doing anything but surgery. So a couple things you can do. that's like, this is the situation where I talk about the back door. So I would go into a family medicine or internal medicine residency where there is a general surgery residency as well, and then you actually rotate through general surgery in family medicine and internal medicine. So you need to get to know the general surgeons and the residents, specifically the interns, and possibly even the program director. And then tell them, like, I want to switch. Like, I always love surgery, blah, blah, blah. And surgery is a tough program. 25% people either get fired or drop out. And so at some point you will have a good shot at doing getting in there. Like, if that's like kind of last resort kind of thing. But, you know, I'd apply to all the surgery programs anyway. Les Extreme, yes. John Locke family. I'm giving away some scrubs at the end of this 30 minutes. Step 2 CS prep courses, are they worth it? I have mine scheduled for September 10th. I did not take a CS prep course. I passed, but I can't say I did awesome on it. Like, I felt like, oh shit, maybe I didn't pass that, and I speak English. You know, initially the CS thing was, is that CK or CS? I can't remember. You're talking about the clinical skills, right? Yeah, CS. So initially that was made for people that don't speak English to make sure that they were communicating okay with patients. And then, rightly so, it was kind of prejudice. And so I can't remember how it came about, but they decided to have everybody take it. So it's more about communication with the patient and not so much your knowledge base. Although you have to have some knowledge base, and you have to have understanding of, like, you know, writing an H&P and review systems and things like that. So if I get another department program, can I go to surgery? Yeah, that's what I was just saying, is like, you can transfer over sometimes. And that's actually a strategy that I didn't realize you could do. The other strategy, before that, I would try and get a preliminary surgery year. And if you can get a prelim year, even though you're not guaranteed a year number 2, you're guaranteed number 1. A lot of times you can get number 2, because the first year is the hardest to get into. After you have 1 year down, then it opens up, and you'll find a lot of different places will have a second year spot available, and you've already done a first year, and so you're set to go. So I would do that. Do a video you watching coming to Grey's Anatomy. Yeah, I saw Dr. Mike did that. It's really funny because he doesn't even work in the, first of all, he's not a surgeon. Second, doesn't work in the hospital. Like, and then he's commenting on surgery. So, like, please spare me. Make a video with Dr. Mike. I tried Mike. Maybe one day. Can you work as a doctor under supervision if you don't match? I don't think Caleb likes the Dr. Mike talk. So I think you have to have a residency of at least 1 year in the United States to practice some places. You can do family medicine. I'm not even sure if it's possible to do that anymore. But most of the time, no. I do not know Dr. Mike, actually. I mean, I know, you know, his social media, from the social media. Hello from Sweden. I'm so stoked about going to med school this fall. Would appreciate you. Follow me. I see it. Limited license for those who don't match in Wyckoff in New York has those. Oh, there you go. It's not a great idea, though, because then you're just putting yourself out there for problems. How would you recommend getting into research as a medical student from Caribbean? Would you recommend it for surgery residency? Yes. And the way you get into research as for any student is you go up to a doctor who is doing research and you go, hey, I want to do research, or you can Instagram them or email them or whatever and say, I would like to do research. I know you do lots of research. How can I help you? And then they'll say, well, we have such and such available, because usually there's certain doctors in hospitals that do a lot of research. And if you are in the hospital already, that's great. You can go up to them or go to the office, whatever. If you're not and you're in town, then I would say just email them and say, hey, I'm here. Interesting. Dang, I got phone calls and I can't see the Instagram. It's so annoying. But where was I? I fucking forgot. Shit. I don't know. I forgot. I lost my train of thought. I get a phone call. Why would you recommend this course for med students? Well, if you're not doing well in med school, then I would recommend it. If you're doing fine, then you don't need it. But if you don't have your shit together and you're like having a really difficult time and you think you're going to have a tough time with step 1 or step 2, then I would say go for it, because step 1 and step 2, especially if you're a Caribbean school student or IMG, is like everything. What is a good USMLE step 1 score? Let me tell you what's a good USMLE step 1 score. 99th percentile. I can't tell you for each year because it changes. When I was there, 220 was a 90th percentile, and that was good enough to give me a general surgery. I don't know that now because I'm not in residency and I'm not seeing those scores, and it's been 5 or 7 years since I've done that, so even more. But the highest, the higher the better. Do patients ever give me shit for swearing? Well, I don't swear at patients when I'm taking care of them. Just about to start 4th year, but torn between emergency medicine and surgery. What considerations should I have in choosing surgery? Surgery is almost twice as long, but you do more badass shit, but you also have less of a life. And depending on what kind of, this is what you also want to make sure you consider. What kind of patients do you want to take care of? What kind of disease processes do you like? Do you enjoy? Do you enjoy physiology? Do you enjoy, do you enjoy cardiology? Do you enjoy gastrointestinal tract? Like that's kind of the thing. And the diseases you find fascinating, that's kind of another way to look at where you should go. You need a personal assistant to organize you. I do have a personal assistant, and I'm still unorganized. She's pretty good, but I still have too much stuff. Love your videos, your inspiration. Thank you. I appreciate that. I really appreciate the feedback. What is your opinion on European medical schools and the difficulty writing an entrance exam to practice in US, Canada? So here's the thing with European schools. The school's fine itself, but the issue with being in Europe for 4 years or whatever it is until you finish med school is you have no connections to the United States. And also when you come back to the US and try to get a residency, you have to have your rotations have to be ACGME certified, and they want to see that you know the American system. And Europe is very different. And when you come here from Europe and you've been used to Europe for 4 years, all of a sudden you go into the American hospital, you're like, what the fuck? Like, yeah, as an intern, you're all like, what the fuck anyway? And then you're all like, European intern, now you're all double what the fuck. So that's the main issue. Plus, you don't have any connections to get a residency. That's a big problem, because if you're doing rotations in the States, then you can talk to those people and do a good job and prove yourself, and then go, I really want to do residency here. And then they'd be like, I don't know, like do better than everybody else. And you're like, okay, fine. That's what I did. I did better than everybody else in that whole fucking hospital in the whole entire year. And they were like, we'll take you. So that's the way to do it. Yes, try and get rotation experience. Sydney M. Whitaker, thank you very much. I appreciate that. What I have to take precautions for step 1? Well, I don't know how to answer that. How should a student get? I don't know about the PA, the surgical PA. Becoming a surgical PA. I see. CST. What is that? Like a certified surgical tech? You don't need to do that if you're going to be a PA. You do not need to do that. Forensic medicine. I mean, I think it's cool. It's just not my deal, but seems pretty awesome. I mean, you guys watch Dexter, right? Dexter's fucking cool. That's forensic medicine. 3 characteristics that this course offers that give an edge. So the course is like basically to help you concentrate, to help you stay motivated, and to build the correct habits that will enable you to study day in, day out without a lot of torture. You know, you don't want to be torturing. Like a lot of people hate it and like, oh my God, I hate this, and they don't finish. Like I had a lot of friends that like hated studying so much that they were in med school, they hated it, and they didn't finish, or they just like you know, end up doing something else. So I mean, if you want to finish, like that's what I teach. What's my plan to keep the surgeon study hacks dynamic? That's a really good question, actually, because you know, it is first of all, it teaches you all the things that I think are important in being able to study long hours over multiple years, over a long period of time. But I think the other thing that offers is a network or a community of people, not only students like you guys, but also I have multiple physicians, so residents, med students, and doctors and surgeons in there answering questions for you guys. And then, so like if you're like a high school student and you don't know what to do to go to college, like there'll be college students in there to answer your questions. And if you are a college student and you are trying to get into med school, there'll be medical students in there answering your questions. And they'll be from all over, everywhere. There'll be some from the United States and some from third world countries and everything. And so we can all talk to each other and kind of help each other with that. I know there's probably other communities like that, but I kind of want to build one myself, and I want to build like kind of a movement, like a movement of people getting together and helping each other like figure this med school shit out, because I didn't have anybody, and that would have been a big help. What are the advantages over websites such as Student Doctor? Uh-oh. Oh, my phone died? Fuck. Shit. 1 second. I would say the advantages over Student Doctor are that you have me and my attitude, and I'm not going to put up with any shit. And so if somebody's a douchebag, I'm going to fucking kick him out. And we're going to be positive. I want to create a positive culture. And I also want to create that not for just the community, but for when you go into your life and become a doctor. And so it's a complete change in attitude. A lot of cultures, especially in medicine, are full of just negativity and people treating each other like shit. And so I want to build a positive culture with that. So thank you, Sonny. Sorry, Instagram. I don't know what happened. My phone died, I guess. But what you missed was I want to build a positive culture of a lot of different people in this community, and because a lot of medicine is super negative, and when I was looking at the forums, I can't remember what they were called, but they were not there, and they weren't really helping each other. Some of them were, and some of them weren't. So I'm not going to put up with any bullshit, negativity, stuff like that. So that's the difference. What's the coolest mind-blowing thing I learned during my work as a surgeon? I don't know if it's mind-blowing or cool, but what's amazing is that people cause their own problems. I would say 85%. And people can manifest, thinking into physicality. And I've had patients do that, and it's unbelievable. 97 US. Designed for US students or Canadian school. Yeah, it's for everybody, the entire planet. It's not just all. It's not even for med students. It's for anybody that wants to learn how to improve studying. I would love to come to Sudan anytime. Not anytime because I work, but I would love to do it. If you want to set it up, just email me, drbuckparker@gmail, DRBUCKPARKER@gmail, and we'll talk about it. Hiring mentors for practicing PAs. So the mentors are, we don't hire anything. They just do it out of the goodness of their heart. But they want to help students as well. So if you want to become a mentor in the course, then absolutely. I'll give you the course for free if you want that. That's no problem. Am I a believer or a believer? Like as in Justin Bieber, believer? I'm not sure what that means. What happened to Instagram here? Oh, man. Despite being a professional, I learn every day. That's right. How does surgeons stand for a long time during surgery? Practice. How much do you pay for medical schools in America? Mine was like about $300,000. Your buddy just bought it? Sweet. Appreciate that. Don't you think everyone needs to find their own way to stay motivated, work hard, etc.? Because why are we med students in the first place then? Yes, you do, but there's certain things that you need to think about that keep you motivated, and that's what I talk about, is how to stay motivated. What are those things in your life? And there's steps to take to kind of drill down in your life to find your motivation. Dr. Stid. All right, what time is it? 32, I'm over. I'm actually over. So, all right, I'll give you guys 2 more minutes, 120 seconds until the clock turns 34. And then we'll do the drawing at that point. Let me see. Is anybody buying anything? If they're not, then I'll just I don't know. Maybe, maybe not. We'll see. Oh yeah, we got some. Oh yeah, shit, you guys did. Good job. Appreciate that. What's the most challenging surgery I've ever done? The long surgeries, because the long ones where you have to go back like you finish and then go back. It's really mentally difficult. Cindy, thank you. Like the vascular surgeries, like fem-pop, fem-distal, those are tough because it's mentally exhausting. Anything over like 3 hours starts to be like difficult. Post-back swelling too. Yeah, there are for sure. What can you take up for menstrual pain when you're on blood thinners? That is definitely not my wheelhouse. Sorry about that. All right, 34. Okay, so let's see. I'm gonna do it right now too. You guys don't even know. I'm gonna draw. Do the drawing right now. So, okay, first pair. Christina Hitchens, sorry. Christina Hitchens. Is that good? Cool. 1. Okay. DO versus MD. I always get that question. Can I have a dose of you? Whoa, whoa. A little frisky there, huh? Second person. Jonesia Schultz. You out there? Hopefully you guys are in the US. I don't even know if we can send them outside the US. So if not, then I'll get you something else. I'm not sure what. We'll figure it out. Third. You guys are getting scrubs though. I hope you guys like. Do you guys care about getting scrubs? I feel like these are nice scrubs though. Have you ever had these things? They're so awesome. I can't see YouTube. Sorry, I'm like not paying attention to YouTube. I'm giving away a pair of FIGS scrubs right here. Well, like we're getting not a pair. We're getting. How do I look? Giving 3 pairs away. And let's see. The last one. Oh, what happened? Lauren Levy. Okay. So I'll email you guys. Okay. And then you can pick your colors and sizes and all that stuff. So congrats to the winners. Don't worry, if you didn't win anything, I have more coming. What's today? Tuesday? Thursday, I'm gonna do another one. Okay. Same time, 12 p.m. Mountain Standard Time. That would be 2 p.m. Eastern. That would be 11 a.m. Pacific. What happened to YouTube? Am I still there? I don't know what's going on. Anyway, thank you guys. I gotta go do some work. And you will flaunt your moose knuckle on that. I don't know about that. King SMK, what up? Okay, so thank you guys for another awesome live, and we'll see you Thursday. Do you guys get that? 11 PST, Pacific, 12 Mountain, 2 Eastern. I got to do that addition, subtraction in my head. So, all right. Take it easy, everybody. See you next one.